Hello, my name is David Haynes, and I'm an assistant faculty member at the University of Minnesota in the Institute for Health Informatics. And today I'll be talking about my poster, Smart Community Health, a patient-centered social care referral platform. And so the motivation of this work is really to focus and understand on how the medical community is really trying to understand and address social care needs, which have been known for quite a long time in the social sciences that they impact health. And while we're really understanding now within the medical community how much they really can affect health outcomes. And so there's been a history of really kind of not understanding what all impacts health. And right now we're really focusing on social determinants or social drivers of health. And in particular, while we don't really understand exactly the percentage that it affects people's health, we know that this is a large thing that affects a lot of health outcomes. And so the patient population that I'll be working with are considered to be high cost, high needs patients. And these are patients that have at least one chronic condition, and they essentially, because of this condition, they visit the emergency department or have an inpatient stay multiple times per year. What's important to know about this is that the patient population is only 5%. They only represent 5% of the patient population, but they account for over 50% of the healthcare costs. And so when you're looking at social needs and social care referrals, so we're talking about individuals that have food, housing, transportation, income instability, these sorts of issues, this is essentially the amount of barriers that these people go through. So they have lots of different issues, not only with themselves, but within the healthcare system and with the community-based organizations who try to provide them these services. So what I did was I developed a social care referral platform called Smart Community Health. And the goal of this was to try to reduce some of the barriers that I just identified. So we have a mobile application that it's an app that you can install on your phone, and it allows the individual to do their own social needs assessment. And we did this because we know that there's often bias of the individual, that they feel like they're going to be judged when they're filling out these forms. And so now they're able to do this in the comfort of their own home, and they're able to disclose the information as they need it. We also decided to develop a community dashboard. And the idea behind this was really that we wanted to open source the amount of information and really allow the community to really populate it with what was really available. And so basically this is a web page that allows community organizations to create and modify their programs. And another benefit is not just that you're putting this information to a computer, but through that system you're able to connect to the people that are screening and understand their needs and connect with them as they connect with your organizations. So this is the technology we built, and this is just a quick demonstration or screenshots of how an individual might do this. And we work with some nursing faculty at our university that developed an assessment tool called My Strengths, My Health. And what we really enjoyed about this, what it was very easy to read and understand, and people were able to then connect to organizations that match their needs. So the study that we did was we recruited 15 patients for a 3-month study. Each patient was asked to download the app and complete the My Strengths, My Health survey. And then once that they had completed the survey, or as they completed it, they could actually connect with organizations on the app. So we didn't make them complete the entire survey before they did. They got presented with their particular organizations, but as they did this, they were able to see organizations they connect with. So a few results that I'll show is that on this one in particular, when we were asking them in a different after every month, were they able to connect? We were able to see that individuals were able to connect with organizations regularly through the phone system. And then we also asked them if they had received any services. We also saw that individuals were able to receive services. So those individuals that were looking for services were able to find them and connect with the organizations that were providing them. And then lastly, as we look at this, there were still lots of other needs that we couldn't completely address. And so we really wanted to highlight that there were still extensive needs within this patient population. But overall, they really enjoyed using the app and found it very helpful for helping them identify and find services that they can connect with. And the community organizations that were participating in this as well were also really hopeful of this sort of tool, because they found this was a new way of keeping the community informed of the programs that they were doing. And so the next steps of this is this technology has been submitted to the National Cancer Institute, and we have a small business application, and we're hoping to do a pilot where we can now introduce clinical teams into this delicate process. Thank you.